Hi, Paul Sackis, Good News Planet. Avoiding a potential twindemic. Experts say flu and COVID-19, double dose of trouble, how you and your family can help. We have Dr. Gregg Sylvester on. Good morning, Dr. Sylvester. How are you?
I'm doing well. Thank you for having us.
Great. And we have Shelley Allen, president of Families Fighting Flu, a national nonprofit advocacy organization dedicated to protecting children, families, and communities against the flu. Wow. Hi, Shelley. How are you?
Oh, good morning. Thank you for having us.
All right, Doctor, why don't we go and ask you why the combination, is it much more, I guess, concerning than ever before?
Well, Paul, that's a great question. And think about it. Last year we talked about it. We talked about, oh my goodness, with this pandemic of COVID, and then we're going to see a surge in flu, and we didn't see that. We actually saw that the social distancing, the mask wearing, all those things prevented influenza from having a bad season. But we're not seeing that this year. We're actually starting to see it start to rise. We're tracking it. The Centers for Disease Control tracks the influenza activity, and it's starting to creep up. It's starting to become like flu before the pandemic. And so now, if we're going to get into our seasonal epidemic of flu in the midst of a pandemic, that's not a good thing. And the best message that I can send you and everybody that's listening to you is to get vaccinated for influenza this year.
Well, I was going to ask you, if you don't mind, Shelley, but why does the CDC, why is this happening? Because of non-vaccination, or why?
No, I don't think so. This is Dr. Sylvester again. I think it has more to do with the fact is that we've relaxed some of those non-pharmaceutical interventions. We don't wear masks everywhere right now. We're social gathering. We've gone back to school. We've gone back to work. We're out and about again. We're trying to lead our lives in somewhat of a normal fashion. And when we do that, we become more susceptible to spreading the influenza virus. So I don't think there's anything magical about it. I just think that it is. We see flu every year. Shelley, do you want to add anything to that?
No, I think you said it perfectly.
Okay. Well, Shelley, but I'll go back to you, Doctor, in a moment, but let's hear a little bit about what the Families Fighting Flu is doing, because, but I wanted to talk about some of these new strains. But let's before we do that, Families Fighting Flu. So, those that are, I guess, by far maybe in the media and with health concerns, know that flu is a serious issue, and flu has been around for a long time, and it kills a lot of people. And it's not, we don't have booths on the corners of streets to get a flu shot. So thank you very much, Shelley, for doing the work that you're doing. Tell us about your organization.
Sure. So Families Fighting Flu is a non-for-profit organization. We've been around for about 18 years. It actually, our organization came about when some family members had lost their children, and they knew that they needed to get these stories out there. And because they are in the same boat as a lot of people, they didn't know the importance of the flu vaccination. And me personally, I actually came to the organization several years ago when my own daughter, who at the time was 12 years old, she was very healthy and active. She actually became very, very sick with the case of a flu, and it landed her in the hospital for 93 days. I remember the doctors coming in telling us that it was more likely she was going to pass than live. She had a 1% chance of survival. Her organs were shutting down, so they had to put her on life support. I can tell you, thankfully, she did pull through. However, it's important to note that the flu can have a lasting complications. This past January, she actually had to have the lower left lung removed due to the damage that flu caused. So, it's not just the flu, as we tend to say. I will say that Madison was not vaccinated that year, and that obviously is my biggest regret. It's not that I didn't believe in the science or believe in vaccinations. It's just that I put it on my to-do list, but never made it a priority. I was a busy mom. So, I had to learn very quickly that, the flu doesn't discriminate, doesn't care if you're, young, old, healthy, or have a chronic disease. So it does affect, can affect everyone, but, the best prevention from the flu is, of course, your annual vaccination. And when I joined Families Fighting Flu, I just wanted to help with their mission to advocate and educate others regarding the flu. So, no other family ends up with a story like mine or the others that are on our website. And I would like to just say that, I didn't have a reminder telling me, hey, it's flu, schedule your flu vaccination. However, Families Fighting Flu does have that. It's called the Promise Wall. And it gives you reminders that it's time to schedule your flu vaccination. So, again, I didn't have that reminder. I wish I had. Had I, this might have been prevented or at least less severe.
Okay. Well, thank you very much for coming out and speaking about your own personal scenario. By far, that's very honorable. You're a hero in your own right here. I just want to mention on your wonderful site here, familiesfightingflu.org, familiesfightingflu.org. I like you have 4 big, powerful stories. Taking flu symptoms seriously in memory of Juliana. Why children need both flu and COVID-19 vaccines, how to celebrate Christmas during a pandemic and flu season, and 5 ways to give support to grieving families during the holidays. So I suggest for people to go take a look at this website, whether you need it or not. There's very important information because this is a reality, and flu is quite serious. Doctor, so with these new strains, I mean, I think, what do you think is going to be happening? Because people are now, not becoming as lax again. It's up 30-40% in certain areas. We know it seems to not be as, as I'll sadly have to say, it's killing as the other COVID, but that's a lot based upon having vaccinations. Isn't that so?
Yeah, I think that's right. When we talk about new variants, you're talking about COVID. Don't forget, influenza has new strains, or they actually drift during year to year to year. But let's stay with COVID for a second. It appears at this point in time, before the holidays, that this new strain is highly infectious, but may have less symptoms. But if in fact everybody gets infected, we're still going to overcrowd our hospitals, and even if the symptoms are minor. And that's why it's important to get vaccinated for COVID, but also to get that annual flu vaccine. We're seeing influenza come back this year. It was historically low last year during the pandemic. That's not the case this year. So the CDC recommends every person 6 months and older to get a flu vaccine, and Shelley and I want to endorse that recommendation.
So here's a staggering fact that you have here. Children under 18 years of age suffered nearly 52,500 flu-related hospitalizations and 434 deaths in 2019 and 20. But if we add the older people, it seems to be every year a very high number. Isn't that so, Doctor?
Absolutely. Absolutely. And those numbers, I want to just say on behalf of Securus and Families Fighting Flu, we're really excited about talking to you. But those are not our numbers. Those are recorded by the Federal Public Health Agency, the CDC. And you can see that this, many of us have had flu, and it's been mild, but we just don't know. And when you have nearly 500 children die several years ago from influenza, and when you add adults onto that, it gets into the tens of thousands of people that die annually every year from influenza. Not a lot last year, but let's make sure that doesn't happen this year.
I agree with you, and it's so easy to get the flu shot as well, especially since they some years ago opened it up to pharmacies? Is that national? You go to. I mean, I go to my doctor directly, but pharmacies as well, right?
That's right. And it really is, it's a funny system in the United States. We do it state by state. But I'll tell you that I have a wonderful primary care doctor, but I always go to my pharmacy to get my influenza vaccine. When you're a little child, many states and many pharmacies want you to go back to see your pediatrician. I am a pediatrician, so I like that idea. But it's important whether you go to your clinic, your pharmacy, your doctor's office, any healthcare professional, just make sure that you ask to get an influenza vaccine, not only for you, but for all of your loved ones, the family members that you want to spend the holidays with.
Okay, thank you both very much. FamiliesFightingFlu.org. Please all take a look at that, as well as make sure you get a flu shot and make sure you have COVID shots. I will say that as well. Thank you both very much.
Thank you very much.
Thank you, Paul.